heart disease has grown 300, 400%. And especially over the last 10 to 15 years, it's also grown in the young individuals, far more than we'd ever seen. We rarely saw a young heart attack 30 years ago. We now see it commonly. So we are the world's capital of heart attack, by the way.
And our guest for this episode, none other than Shri, Padma Bhushan, Dr. Ashok Seth, Chairman of Fortis Escorts Heart Institute, Chairman of Fortis Healthcare Medical Council.
हमें healthy खाना है, हमने healthy lifestyle maintain करना है और आज हमने exercise की कि नहीं. इतनी भी साथ में और पूजा कर लोगे ना तो हम heart disease को इस देश में prevent कर सकते हैं. What stops us from having a treadmill in one of the rooms to say if you got a 15-minute break, you could do this treadmill rather than just जाके चाय और समोसे खा. Lunch break में why not have a treadmill? Encourage exercise. This should become a policy. Why can't we remind every office, every day to be heart healthy? Even today, live in a pollution which would be otherwise unacceptable to the West. And that's one of the reasons why heart disease got grown up, especially in the young, especially in the youth, who are on those polluted streets. Every one of us needs to just go once to a GP. BP check कराने के कितने पैसे लगते हैं? एक blood test, इसमें की sugar, which is a silent killer, cholesterol check होता है. मोटापा तो हमें खुद ही पता है क्या है. स्मोकिंग तो हमें पता ही है कि हम क्यों कर रहे हैं और मरेंगे. प्रिवेंशन इज एक्चुअली इट्स इनएक्सपेंसिव. एक्सरसाइज 500 रुपए के जूते आते हैं जिसके लिए एक्सरसाइज करना है. दैट्स ऑल वी नीड. सो इफ वी डू दैट, हमने सिगरेट के भी पैसे बच गए, हमारे अल्कोहल के भी पैसे बच गए. नॉट ईटिंग फ्रॉम आउटसाइड एंड ईटिंग अ हेल्दी डाइट, तो हमारे तो पैसे रोज के बच रहे हैं.
Hello and welcome to The Big Idea, one of a kind initiative by Voice of Healthcare, where we explore leadership journey, life lessons, and big ideas that are shaping the future of healthcare. And this episode marks a very special conversation on World Heart Day 2025. This year's theme is Don't Miss a Beat, which is a powerful reminder for all of us to stay alert of our heart health, to check, to monitor, and to act on time before it is too late. And our guest for this episode will help us to understand this in a very better way. None other than Shri, Padma Bhushan, Dr. Ashok Seth, Chairman of Fortis Escorts Heart Institute, Chairman of Fortis Healthcare Medical Council, and Adjunct Professor of Cardiology at Jain Medical College, Aligarh Muslim University. Dr. Seth has led the field of interventional cardiology over 4 decades, performed more than 25,000 angioplasties, and trained hundreds of cardiologists, and is leading his way and inspiring countless lives with his inspiring work. Welcome to our show, sir.
Thank you very much, Sima. Good to be with you.
Thank you so much, sir. It's an honor to be with you, and the entire healthcare fraternity is proud of your achievements. And it's great that mankind of this era is getting benefit of your knowledge, expertise, and your passion of advancing cardiac care.
Thank you, Simiran. It's just been a journey. Everything which has happened has been, should we say, automatic. Didn't aim for all these achievements. Didn't aim for just was passionate about what I was doing. Just be committed, and then everything came, should we say, as a byproduct. And whatever you said is never been visible to me. It's always people like you talk about it and say, "Oh, what tremendous achievements!" Just a byproduct of a lot of focus and commitment. That's what I'd say.
I think that is the passion which makes the way, which leads and which makes it happen.
Yeah.
So to begin with, we would like to start with your journey. What drew you to cardiology? What inspired you to keep on going on?
To tell you frankly, what drew me to cardiology was the fact that I became a cardiologist out of a default strategy. I didn't want to become a cardiologist because when I was training and I was in England, cardiologists really were stethoscope cardiologists. There was nothing much to do in cardiology. Even a heart attack patient was just put into a CCU and nursed for 2 weeks or 3 weeks and then gradually sent home. What was fascinating at that time was gastroenterology, where you could actually do endoscopies. Bleeding from the stomach could be sclerosed. There were numerous interventions in gastroenterology, so it fascinated me. So I was training in gastroenterology. I wanted both trainings as a rotation, and as they call it, a registrarship. You had a rotation. So I'd done cardiology, I'd done gastro. I was going for the next step forwards, super specialized training. And I just didn't get the job which I wanted, which was an interventional gastroenterology job. And as a default strategy, in the same university was available a cardiology super specialization post. And I was at a teaching hospital, which was very few Indians ever got into teaching hospitals. And I was favored by the professors, and they said, okay, why don't you take up the cardiology? I said, cardiology, ye to stethoscope wali baatein hain. What am I supposed to do with that? Anyway, that's how I got into cardiology. And then that was 84 when we were just about to start angioplasties as an intervention technique. Our hospital, University Hospital, started that. I was right in the middle of it. In the super specialization, I got trained in the techniques of angioplasty, and I therefore developed that field further. And suddenly I started believing that there's so much to do in cardiology, and the cardiology field transformed in front of my eyes from being an endoscope to a stethoscope, and not a stethoscope now to interventional cardiology. So yes, I'd say that default strategy, but a good path to have taken up right in the beginning of this whole field, which then I was able to not just see it develop in front of my eyes, but also be able to contribute to it for its growth, development, and pioneering of many new technologies, not just in India, but across the world as well.
Very rightly said, sir. It is being developed, and see, the destiny plays a huge role. You wanted to enter into gastroenterology, but we wanted you, or the future wanted you to in cardiology, so that you can treat and create an impact for our public out there.
Yeah, but just for your listeners and viewers, it's always God wills it.
Yes.
You can define your own destiny and say, but I planned this all out perfectly and I will achieve what I've actually defined myself to do. Believe me, that may not happen at all. And any amount of definition that we say we can't, our greatness can never be attributed to our defining a path. God defines the path. We just remain committed and passionate about what we do.
Very rightly said. So I think the passion is required the most there, sir.
Yes.
So since we're talking about World Heart Day, our theme is don't miss the beat. And we know the cardiac situation, the cardiac health situation in our country is basically declining years by year.
Absolutely.
And I think India is one of the countries which is contributing globally in cardiac arrest. So if you could tell us about the current scenario of India in terms of cardiac health and how it is contributing globally out there.
And I've watched this now for more than 35 years of returning back to this country and being in the midst of high-end tertiary cardiology, defining techniques, developing techniques. In fact, the way science has grown, firstly, let's just understand, the way science has grown, the techniques that I was saving lives with 30 years ago, 35 years ago, now seem crude and almost unethical because science has developed so much forwards. The same angioplasty techniques I do now compared to what I was doing 30 years later is a whole different situation altogether. Science has really progressed immensely. But at the same time, what we've seen in India is the progress of coronary artery disease. Heart disease has grown 300%, 400%. And especially over the last 10 to 15 years, it's also grown in the young individuals far more than we'd ever seen. We rarely saw a young heart attack 30 years ago. We now see it commonly.
Yeah.
So we are the world's capital of heart attack, by the way. We're 5 times more prone than the West to develop heart attacks, 6 times more prone than Chinese, 20 times more prone than Japanese. But it also relates to the fact that we are also the world capital of hypertension, high blood pressure, and diabetes. And along with that, unfortunately, over the last 10 to 15 years, we've really developed bad habits. Our youth, our younger gen, has had change in lifestyle. And this lifestyle revolves around lack of exercise, being overweight, long working hours, chasing timelines, unfortunately, less of sleep, more of alcohol, smoking has gone up. And our whole food habits have changed immensely to fast foods, trans fats, ready-cooked meals, everything. So the healthy lifestyle has gradually disappeared into our present day of stresses and other things. And unfortunately, 200% increase in heart attacks in young, less than 45, is an immense. That 200 is in just 15 years. We've doubled the heart attack. It is very these images that we see sometimes of a young person collapsing following a strenuous exercise. Uh, uh, one doesn't like to see them. And one knows that this could have been a coronary artery disease, a heart attack which has happened and suddenly led to a sudden collapse and death. So I think we are looking at a situation, and I'm glad that we have to emphasize year after year on the World Heart Day a theme. But I believe every theme which has been created is for every day and not for just that day. Perhaps that day of World Heart Day is a reminder to everybody that every day, every moment of your life has to be that theme. Take some time out for your heart. Every heartbeat counts, and it matters to every one of us. Even as I sit here, I say, if we understand that 50% of the heart attacks are happening in age less than 50 and 25% of them are age less than 40, any of us sitting here could suddenly have a heart attack. We're all prone to heart attacks. We've got to take full precautions and we've got to be preventive around it.
Very rightly said. So I think that prevention is the best intervention in terms of cardiac health, or let's say in terms of any other specific disease, right? And like you mentioned that it's not necessary just to speak about heart health on this heart day. It's every day, every second we need to monitor, we need to work on it.
Yes, absolutely.
So it's been 4 decades you are into this industry. If I have to ask, what changes have you seen in as compared to when you started and now, in terms of the risk factor, in terms of people with the onset of this disease, or let's say in terms of the attitude we just spoke about?
So Simran, I would say, just correct you for the fact that I would say you said in this industry.
Yeah, sorry.
And I call it a profession, and I think for everyone who is a doctor, I would say we are lucky to be in a profession
Hmm.
where we get countless blessings, innumerable blessings, by patients, by the relatives, by everyone, including our family, by the way. Even if we get home late, they are still blessing us for just doing our daily work. There's no other profession as good as this, where दुआएं मिलती रहती हैं हमेशा, और क्या रोज का के काम करके वो घर चले जाते हैं जो काम हमने सीखा था. And therefore, in this profession, one of the things which I've seen, and I've also seen, and I'll also tell you, I've not just seen change in disease processes over a period of time, I've also seen the changes in technology and contributed to those advancements in science and technology which are able to save lives of patients which we could not. For example, heart attacks used to be treated by, in front of my eyes, happened that 4 weeks of doing nothing and then go home, rest. In front of my eyes came in a clot dissolving drug, clot busters, as we call them, the streptokinase, first trials, that now we could do something for a heart attack, give that clot dissolving drug straight away, which then transferred another 10 years later saying angioplasty, put in stents, and that saves lives. And now patient comes in with a heart attack, minimum time he's rushed to the cath lab, the artery open, a stent put in, and it saves lives. And the heart attack death rate from 25% come down to something like 3 to 4%. Not just these advancements in technology, we now replace valves without surgery with a risk factor which is practically 1 to 2% in even elderlies. So having contributed to all these technologies and growth is also a change in our philosophy as a doctor. What I've spanned 4 decades, as you said, of this practice. In the first decade, my aim was to get those treatment technologies which existed in the West to India. Why should any Indian have to go abroad for treatment?
Yeah.
Why shouldn't every Indian have access to advanced and high-level expertise and care to be delivered within the country? And therefore, we brought in standards and did techniques which weren't being done in this country and which only were being done abroad. Having done that in the first 10 years, became my next mission was, why not train more and more doctors here and in Asia Pacific region to exactly perform the same things that I could do? And that again was a decade. So I've trained 3 generations of interventional cardiologists to doing those techniques, doing courses, going out there in their hospital, teaching it, doing live cases, transmissions, etc. And that all evolved into generations. I mean, 50 interventional cardiologists in Bangladesh got trained by me over the last 20 years. It was Philippines, it was Singapore, it was Malaysia, it was even going across to Indonesia, and I went across to even China in the 90s to get them started on angioplasties. So that's been a tremendous journey of teaching and training. And then once you've done that and you see this increase and more increase in heart disease, you say, gosh, my focus now has to be prevention.
Yes.
My focus has to be, why is this youth who forms 50% of our population, and I am distressed to see them, not because they're doing anything wrong, but just the lifestyle and the world around them has changed to the extent that they can't help it, but they need to understand and need to know, because if that's 50% of our population and they have all these risk factors, imagine what's going to happen in 10 to 20 years, where majority of our population would be suffering from heart disease. It is worrying. And therefore, prevention. And our youth needs to understand more than anybody else that they have to live healthy if they want to progress properly in their life, and they've got a whole lifetime ahead of them. So our responsibilities become, even when we sit in the OPD and I have the most complex angioplasty patients who I've treated and they sit in front of me, I prescribe him medication, but my sermon is not to him. My sermon is to the relatives who come with him, saying, आपने भी वही करना है precautions के लिए जो ये कर रहे हैं. What happens is that the patient who's had the treatment, वो आके बैठ जाता है, and the rest of the family say, इनको तो हम अब बिल्कुल तेल के बगैर खाना दे रहे हैं, इनको तो अब हमने बिल्कुल सब चीज़ हटा दी इनके लिए. The poor guy who's had the heart attack is like losing weight and feeling weak, while the rest continue to have nice meals around the table. उनके लिए separate खाना बन जाता है, and yet everybody should be having the healthy meal. So it's very interesting psychology, where we have to emphasize to everyone. So for us, and I say that to every doctor and every listener, and in fact every person in every household, I say, जो हमसे सीख रहे हो ना, रोज जाके घर में जैसे बैठ के खाने के टेबल के अराउंड आप पूजा करते हो, पहले साथ में ये भी पूजा कर लो कि हमें हेल्दी खाना है, हमने हेल्दी लाइफस्टाइल मेंटेन करना है, और आज हमने एक्सरसाइज की कि नहीं की. इतनी भी साथ में और पूजा कर लोगे ना, तो हम हार्ट डिजीज को इस देश में प्रिवेंट कर सकेंगे.
Very rightly said. So I think this is a very strong message which is out there for our public, and we need to understand that how exercise, prevention, good health, good eating habits will help us, decline the rate of cardiac arrest in our country, and become one of the examples in across the world, that how India has shaped or changed the narrative in terms of cardiac heart attacks.
बिल्कुल, it's so important, and I think everybody needs to understand it, realize it. We talk about governmental policies.
Yes, sir.
And I think no policy is needed to decrease heart. Reminders. We're all prone to it. And it's so important that these reminders, in a way, those sad scenes of collapsing, people collapsing and dying, whether it's after exercise, whether it's after strenuous exercise or anywhere else, in a way are not nice, but at least they remind everybody that ये तो हमें भी हो सकता था. हमने अपना चेकअप कराया कि नहीं, हमने अपने रिस्क फैक्टर्स को कंट्रोल किया कि नहीं. Every time I'm talking and I'm giving a lecture, I say, मेरे को 5 रिस्क फैक्टर्स गिना दो, and हर एक को पता है 5 रिस्क फैक्टर्स. ठीक है, स्मोकिंग, डायबिटीज, हाई ब्लड प्रेशर, मोटापा, कोलेस्ट्रॉल, ये सब तो हर एक को पता है. और फिर पूछो कि इसके लिए क्या कर रहे हैं, तो दे थिंक हार्ट अटैक तो किसी और को होगा, मुझे नहीं होगा.
रिस्क फैक्टर पता है, लेकिन काम क्या करना है वो भी पता है, पर करना
नहीं है.
ट्रूली एग्री सर.
पता, पॉलिसीज में जब मैं सोचता हूँ, पॉलिसीज आर नीडेड.
Yes.
पॉलिसीज आर नीडेड फॉर ट्रांस फैट्स. ये तो बहुत इंपॉर्टेंट पॉलिसी हिंदुस्तान में होनी चाहिए, क्योंकि इट इज़ नॉट फैट विच इज़ बैड. हम लोग कहते हैं ना कि ये इस खाने में बहुत फैट्स है, नहीं खाना चाहिए, या फैटी फूड नहीं खाना चाहिए, तेल नहीं खाना चाहिए. Actually, all that is wrong. Fats are needed by the body, by the way. They need it for our brain cells, they need it for connections, they need it for stability of many of our parts of the body. But it's the wrong sort of fats. तो जो trans fats हैं, which are actually in many of the stored foods, many of the cooked, recooked oils, many of the the namkeens that we eat, many of the खाना जो बाहर का हम बनता है, many of the kachoris and stuff like that we are supposed to be, and samosas that we have. Trans fats exist in a huge quantity in our daily habits. And we need to know the trans fats on everything that we pick up, right from a biscuit to a namkeen to a cake to a pastry. We need to know the trans fats. So government policies should exist around trans fats. Government policies should exist around strictly banning smoking in most places apart from very open spaces. It should be reminding. I think those do exist. They should exist around areas, and they should exist even for offices having heart healthy. We talk about heart healthy environment and plants and everything else, but why aren't we talking about heart healthy offices? Give them points and give them like electric vehicles.
Yeah.
We should encourage them and give them some sort of an incentive to be heart healthy. Why have a canteen which actually serves fried stuff and rather than not healthy stuff? And okay, if you say, but people, our employees don't like it, but okay, what stops us from having a treadmill in one of the rooms to say if you got a 15-minute break, you could do this treadmill rather than just jaake chai or samosa khao. Lunch break mein, why not have a treadmill? Encourage exercise, have posters around prevention of heart disease. This should become a policy. It's no-brainer in my mind that why can't we remind every office every day to be heart healthy?
Rather than, I know it's important to focus on the timelines and everything, but simultaneously it should be there that first you need to keep yourself healthy and then follow the timelines.
Absolutely. And then follow the timelines.
Then follow.
Otherwise, you'll never achieve those timelines.
Definitely. Sir.
That's right.
So, since we were talking about the preventive policies and the public health aspect, so how can India strengthen public awareness campaigns and have more of this prevention, awareness policies out there?
Yeah, I think a very important aspect. Firstly, of course, we've agreed to the fact that prevention of heart disease is actually our own responsibility. And we can do that by simple exercise, as we talked about. But I think there are numerous policies which can be put forth. One important aspect to understand is what we said around fats, understanding the food that we pick up off shelves. We understand the fact that the youth has to take fast food, the deadline for everything. It's very difficult to cook. Then it, of course, comes to also understanding a lot from our policies around salt, which can, low salt, less salt can decrease high blood pressure. So understanding salt in our diets is a very important government policy. Understanding obesity. And I'm so happy that one of the biggest voices of health is our Prime Minister Modi ji. I love the fact that every month he's able to talk to the whole of the country and talk about health issues, be it psychological health issues, be it obesity, be it being overweight, reminding everyone. He'll always pick up in every of his monthly talks to the nation. He would always pick up one health topic and make sure everybody starts understanding the importance of that. And I think that also augments so it's not just policies, it is the voice of the nation, as we say. And his Man Ki Baat is tremendous at that. So it's always sometimes we pick up numerous aspects from his talk and say, this is what we got to amplify to the public as well. There are other aspects we say about diabetes, World Capital of Diabetes. The government initiatives which are now checking blood pressure at the roots, at our village levels, checking blood pressure, sugars, because these are so easy to check. And actually, if it starts at the roots, it starts at the tier 3 cities. It actually helps a lot to prevent heart disease because majority of our population lives in tier 2, tier 3 cities and up to the villages. Usually, we believe that low socioeconomic strata has less of this because they haven't got all these trans fats, they probably lead a healthy habit, they probably exercise every day, but that's not the case. You would also understand that if we look at our socioeconomic strata, lower socioeconomic strata is as affected by heart disease as the upper socioeconomic strata. And that's because smoking is high in those Beedi smoking is very high. Tobacco chewing is extremely high. Uh, Hypertension gets unnoticed. Sugar, diabetes gets unnoticed. And in fact, alcohol may exist in much higher quantity than we actually see in low socioeconomic status. So we are actually looking at risk factors even in them. And therefore, profiling of risk factors and saying, teaching the educated, saying, blood test jaake kara lo, cannot be a governmental policy. It has to actually percolate down to people to say, how do we check you up? How do we tell you to eat less salt? What are the healthy foods that you can actually eat? And the healthy foods just consists of fruits and vegetables, which are available in every farm. Well, everybody cultivates them. And so food for them is good vegetables, but also get rid of the habits which exist at the grassroots levels, I would say also. So those are policies which are absolutely there. After all, we have initiatives which abolish polio, which has decreased tuberculosis to practically nothing. And those are all governmental policies which have done that. So this is very easy for the government at this time and is achieving that at grassroots levels. And I'm very happy about that. What I believe also the government has initiated and the policymakers have initiated very well is for all the stakeholders to sit around the table and talk to each other, which has happened during COVID. And that may be the silver lining of COVID, where where public policymakers, where public hospitals, with healthcare workers, where private and public healthcare workers, with the industry, the device industry, with the drug industry, and with the patient sat all together and at every step fought COVID together as a single unified nation, but also as a unified entity. That is the advantage which now our policymakers are taking to say, let's abolish other disease processes. And I'm so much more happier now than I used to be in pre-COVID days because of the positive policies which have come forth. And I therefore see a better outcome of all these initiatives in times to come. But finally, at the end of the day, what he says, हमें खुद को समझना है ये बातें, because 75% तो effort of prevention अपने आप से ही आ जाता है. And the 25% the government policies get out. Yeah, but let's not forget one very important thing that we haven't talked about. We talked about all the risk factors.
Yeah.
But the two recent risk factors which you see causing those sudden deaths or causing heart attack in the youth is clearly pollution as well. Pollution has actually been shown to cause heart attacks, to cause inflammation in the heart arteries. ये जो sulfur dioxide, carbon monoxide, those all the 2.5 particles जो होते हैं, they all go into the lungs, then into the arteries, create clotting of the arteries, cause inflammation of the heart arteries, and create heart attacks. It's been well documented. During highest pollution days, heart attacks increase or double. And we need stronger policies for that. If we're going to talk about everything, then I think that's where we're missing out. Strong policies. We only have lots of statements.
Yes.
Pollution हम कहते हैं उन्हीं दिनों को जब 4-6 हफ्ते की pollution होती है. But can you believe those polluted days are unacceptable, hazardous across the world? उस वक्त तो countries in United States, in Canada, in every country, they shut off everything and say कि घर है रहना. That's what we live in every day.
They don't operate those days.
They don't operate those days. In fact, जो हमारे अच्छे दिन हैं वो उनके लिए सबसे खराब दिन होते हैं और जो हमारे सबसे खराब दिन है उनके लिए तो बैंड डेज हैं. I hope you understand. So we actually even today live in a pollution which would be otherwise unacceptable to the West.
Right.
And therefore, we are suffering from pollution and heart disease in a big manner. And that's one of the reasons why heart disease got grown up, especially in the young, especially in the youth, who are on those polluted streets, on their motorbikes or on the public transports or all day, earning their livelihood. Be it a guy delivering at Zomato ka, who's delivering somewhere, or be it just going to work on a motorcycle, be in a public transport, on the roads, spending hours in those fumes we were just talking about, the traffic, just that itself. So I think strong policies, not just lip service, but strong policies, and policies not just for those 4 weeks that we talk about in कि उस वक्त तो crop जल रहे थे, so that's why we had the pollution. It is day in, day out, and more awareness around that. And of course, COVID did cause an increase in heart attacks also. It's been demonstrated that those who had COVID 50% of the deaths during COVID from severe COVID were due to heart disease itself. COVID was not just a lung disease, it was a heart disorder. But not just that. In the next year after COVID, the heart attacks had increased by 200%. And that effect lasts on an individual even up to 3 years, it has been seen. A person who's had a COVID and has recovered from it is at an increased risk of heart attack for up to 3 years. And that's because what's happened in the arteries of the heart, the inflammation, the increased thrombogenicity, the weakening of the heart muscle, which the COVID has affected, continues to run on and on and on. The post-COVID syndrome, that continues a large data, large follow-up data, which only West can have in terms of large, they can follow up even 10,000 patients to 100,000 patients over a period of time because they all systematically can be located. The Cleveland Clinic recently published the data of 100,000 COVID patients. Up to 3 years had an increased incidence of heart attacks compared to a normal population. So it was just amazing to understand that we have a new risk factor amongst us. And so we need to therefore start understanding more about prevention. Of course, in India, we also understand that smoking, tobacco, diabetes, hypertension, and obesity, which means raised cholesterol levels, are the highest risk factors, and our abdominal obesity and high triglycerides and low HDL are important factors. So when we boil down to prevention, we say, एक बार अपना check कराया. And I think it becomes important. We talk about checkups and everybody comes back to me and say, yeah, ये checkups तो बड़े expensive होते हैं. And I say, what is an expensive checkup? It's not expensive. In fact, what do we need to know? If every of us, and I say this now strongly, every one of us needs to just go once to a GP. BP check कराने के कितने पैसे लगते हैं? Nothing. एक blood test जिसमें की sugar, which is a silent killer, cholesterol check हो जाए. That's all that we need. मोटापा तो हमें खुद ही पता है क्या है. Smoking तो हमें पता ही है कि हम क्यों कर रहे हैं और मरेंगे. So और क्या चाहिए? एक checkup from a local GP defines for us our risk factors. I know I've got cholesterol or not, मेरा बीपी ठीक है कि नहीं, मेरी डायबिटीज है कि नहीं, मोटापा मुझे खुद ही पता है मेरा वेट कितना है, एंड देन क्या पीता हूँ, कितनी शराब पीता हूँ या कितनी अल्कोहल पीता हूँ या कितनी स्मोकिंग करता हूँ, मुझे पता. If I control those, I've done my job.
Yeah.
It's so simple. एक echocardiogram. An echocardiogram is a very simple investigation available at every door site, doesn't cost much. It actually completes all that we know to do. Any specialized test, leave it to the doctor to decide. But हमारे तो risk factors, all we need to know is our risk factor profile, and all we need to know is how we take care of that. It's so simple. Prevention is inexpensive. If you see कि क्या खाना, good healthy vegetables, exercise, वो 500 रुपए के जूते आते हैं जिसके लिए exercise करना है. That's all we need. So if we do that, हमने सिगरेट के भी पैसे बच गए हमारे, alcohol के भी पैसे बच गए, and then we have everything else that we actually now not eating from outside and eating a healthy diet. तो हम बाहर वाला खाना भी नहीं खरीद रहे हैं, तो हमारे तो पैसे रोज के बच रहे हैं.
Exactly. I think eating all those things, smoking and everything is expensive rather than, saving yourself from this cardiac risk.
That's right. So prevention is actually the cheapest way to go.
The cheapest way. And if you're not doing that, then be ready to pay bills of hospitals.
Right. People always ask me, is alcohol bad for the heart? So I mean, this comes up as a question. Oh, मैंने alcohol तो बोला. Excess alcohol is really bad for the
Yes.
heart. Excess alcohol is bad for the heart, and people who sort of drink alcohol may go from what they call moderate to excess at any time when they don't know. So if I have to tell your views about this alcohol thing, not to disillusion anybody, small occasional alcohol is in moderation socially is not bad for the heart. Okay, it's smoking, even if it's just single cigarette smoking is bad for the heart. Sitting even with smokers is bad for the heart. Passive smoking is as bad. Living in the community of smokers itself is bad. But for alcohol, social drinking is fine. What is wrong is regular alcohol, daily drinking, high quantities of alcohol, and even binge drinking. अगर कोई जाके कहता है कि मैंने 2 हफ्ते में एक ही बार पीता हूँ, बट जब जाता हूँ तो दोस्तों के साथ मजा आ जाता है, and I have 10 drinks at that time, oh my God, that's bad.
Yeah.
That can really affect the heart. So that's where alcohol stands, and that's why we talk it more of it as a bad social or a bad personal habit, but don't tell people to stop drinking alcohol if they're just once in 2 or 3 weeks having a drink with a friend. I think that's got to be put into perspective.
I think there are many of the silent factor which we just discussed here, like the 5 factors we are discussing since the start are very much visible and aware that we have to check all those things. But few of the silent factors you just mentioned is the pollution, the COVID, and the alcohol, which we think is not so bad,
Correct.
but that is creating a huge impact as well.
Heavy alcohol intake damages the heart, like the heart becomes so weak.
Yeah.
It damages the coronary arteries. It creates heart attacks. It's probably one of the important factors of why we see rising heart disease in the youth is known that our alcohol intake in this country has increased in the last 15 years, much more than any other country in the world.
Definitely. So the credit also goes to how easily and readily it is available nowadays. And in terms of smoking, we have that vape cigarettes and everything that is being more addictive.
Yes. Yes,
I
brought that
think
frankly.
those are the most contributing factors also there.
You're so right. You brought that in, and everybody needs to understand. The youth needs to understand. It's not just that; it's the vaping which has also increased
Yeah.
in as a fashion rather than anything else, and that's affecting the youth in a big way.
Just as we are moving towards the closing of this session, this amazing conversation, any inspiring message or closing remark you would like to give to our audience listeners on this special day?
Yeah, I think your listeners are widespread. They would include public, they would include doctors, they would include scientists, the researchers. Yeah, of course. On a World Heart Day, the message is always, we are responsible for our heart. हम जो भी मैं कहता हूँ दिल से कहता हूँ और we have to understand that I keep saying, I've said this before. How do I know myself that sitting here I could have a heart attack in the next 15 minutes? And therefore, isn't it always my responsibility to say, क्या हो सकता है, मुझे भी हो सकता है और मैं अपने आप को बचाऊं? We've said this multiple times, but I think there's also an aspect that I would emphasize. For the doctors, I would say that we came into this profession with a commitment. For us, it's not a business.
Yeah.
For us, it's a profession which is noble and it blesses us every day. So the 5 C's, which I talk about for every medical fraternity, is a very important one to keep in mind. And the 5 C's are care. We need to care for our patients just like they are relatives. Empathize. It's empathy, not sympathy. Commitment. We've already talked about that. We can't get anywhere without being committed to this profession because it's going to take us time, hours. We can finish work at 12 o'clock. We can't grumble about that. Competence. I think we need to be competent enough to deliver to our patients, keep ourselves upgraded, and do better and better for them. And we have to be committed to whatever we're doing, and therefore we have a rapport to build with the patient all the time. From the time he walks in, we've got to respect him. From the time he walks in, he's got to trust us. He's putting their lives in our hand, and there's got a commitment to him. There's a compassion around that. And finally, there's conscience. Whatever we do, we got to do it with ethics. And those ethics have to be so strong that we should go home saying, thank God what he did today was absolutely for the patient. And that's how we sleep at night. And when we get up, we say, thank God that you delivered to our patients. Just continue to deliver to our patients all the results, all the good results. And that would be fine for all of us. So I think we live with these 5 C's. We do a lot. For the public, I'll say just trust your doctor. Build a bonding. Let's not be a Google society. And let's not just think it transactional. Every doctor is here to bind. Everything that you do, you're putting your trust into a doctor. The doctor's responsibility is to live up to that trust. Let's continue this noble profession far and wide to make it exemplary. And of course, finally, health is an important aspect. We must look at health as the most important thing. It keeps us and our family together. It keeps us alive, and every heartbeat matters. And so not just on this World Heart Day, every day, every minute, and every second, you got to remember The heart is most important. The health of our heart is in our hands and in our feet. And certainly the responsibility for the family is also in a unified manner for all of us, so that we build this in our family and that we are able to spread this far and wide and influence others so that we can all stay heart healthy. That's what I'll say.
A very strong message to all our public out there and to the doctors, as said by Dr. Ashok Seth. Thank you so much, sir. This message reminds us and will keep on reminding us that it is not only for the hard day, it is for the everyday affair, that we don't need to miss a beat. It is very important for us, and the best way to do is prevention, and prevention is inexpensive, said by you, sir.
Thank you.
Thank you so
Perez.
much.
Good to talk to you.
Same here, sir. Thank you so much for sharing all your wisdom and knowledge on this special day. It was really great to have you with us here today.
Thank you.
Thank you, sir.